All right. We are back and recording. So I'll send two recordings to you with this, just to let you know it, they process about the same way time wise. Nevertheless, this is where we left off. 6 major roles. I'll give you it's a matching thing on the exam. Okay. Can you handle it? I'm trying desperately. I think it's a wise idea to frame it to what you want to do is hope, because a lot of this stuff should be familiar to you. I would think a certain amount of this you've had before in other classes to try to make it easier to get a good start grade wise. Because we're only going to have one grade before midterm because of all the stuff that's going on with the lab, and then go from there. I'm trying to be as clear as possible, and I'll do a recording. And I basically look at the exam. You won't see any pictures, just hear my dulcet tones. With the dog barking in the background as he's wont to do. Okay? So I'm trying to do. So that's where he's coming from. There's only going to be from this maybe a 10 question section in this. Most of the questions are going to come from that biochemistry chapter. That's where most of it comes from. I think there's going to be 65 questions on the test. Something like that. You guys have plenty of time to do it. That's the good news. We'll do it first when we get in here on that day in 2 weeks. Okay? Then we're still going to have class after that. Yeah. For those of you who are, and you should stay here. Because we can't, I can't lose a whole week for one test. Can't do it. Moving on. More about that next week. The parameters. You'll have adequate time, absolutely, to do that. Membrane proteins. Number 1 in the hit parade, transport. I showed you before. Sometimes they span across hydrophilic channels, so it's designed, it's friendly to water, friendly to charged particles, friendly to things that aren't made out of, that are not soluble in lipids or fats or in the membrane. They have to move through a protein channel, so they have to be water compatible. The most famous ones are ones for water. So it's selective for a particular solute or for water. Solute would be like a charged particle, or for water itself. Some of them change shape. Okay, they're a different kind of a transport channel, but some of them have to utilize ATP in order to get the material out for whatever reason. So there's some, and whenever you see the term pump, that means it's active transport. That means it is utilizing energy. Those are pump and active transport are synonymous. Active transport is a way that we have to move. We utilize it down the road, as you'll see, very efficiently. When we're moving something out, we'll often move something along with it to facilitate sort of getting the maximum bang for our buck, energy-wise speaking. But a lot of times people will fool you with the pump. The busiest, where our energy is mostly used in our body, you will see relatively shortly, not today, I would think, in this class, they're called sodium-potassium pumps. We're constantly resetting the cells with regard to sodium and potassium because it's always changing. And that has to do with what we call the resting membrane potential of the cell. And so there's, again, another one I don't want to necessarily play. I don't even know if they're going to change. These don't do a whole lot, is my recollection. So I don't even think that thing did anything. See, it's just showing, stuff's coming in. So sometimes the channel will just open when it's there, and sometimes you have to impart energy, and sometimes you'll see the molecule will actually induce it to change shape. See, I don't get a lot out of that myself. You saw a little bit about this before. Okay, signal transduction. We use the term transduction a lot. It's basically turning one force into another. Mostly we do it in terms of receptor signals. The sound of my voice, your ear is a mechanical signal that your brain is receiving as an electrical signal. It just has learned to interpret that electrical signal as words or phrases or things like that. So anything, when we're changing one thing, we're changing a messenger from a chemical to something inside the cell. So mean, it's class, you know, and it's sometimes when that door closes, someone will have it on the lock. And I'll be sitting here talking, I'll see here knock on the door. Okay, that knock on the door is a signal from the outside. I'm hearing that signal, I'm transducing it outside, I realize that somebody must have inadvertently closed the door. And you gotta get up and you have, an action will follow. You gotta go over and unlock it, open the door, put the door, the thing to hold the door open, and we're good to go. That's basically signal transduction. The proteins are too big by definition. Insulin, all of these are large molecules. They can't get inside cells. Cell couldn't hold them satisfactorily. They're disproportionately represented there. And what happens by doing something, typically the protein is embedded, if this is the membrane. Oh, please don't. So the membrane is here. So, I mean, here's the insulin contacting my hands, and effectively what it does is it causes a change on the interior. I don't get my feet. So basically, something from the outside is inducing a change in the inside. Insulin does this a lot because it sets up that it's like the feet moving with a chain reaction of multiple things that go on inside the cell. One of which is to open up protein passageways and allow glucose to enter. One of the many roles that insulin has is the best example of that. Down the road, you'll see we call this facilitated diffusion. A lot of glucose is outside. When it enters the cell, it always changes immediately because it's energized. It's phosphate, so it changes. So we always have glucose outside the cell at a much more abundance than inside the cell. Once you open the passageway, in comes the glucose. It's one of insulin's jobs. So it facilitates the entry, and that entry is by a process called diffusion. Higher concentration outside. To me, think of all the years I've been doing this, it should be, I should understand it. So, chemical messenger, change in shape in that protein, and initiates a chain reaction. So insulin, it causes the cells to, it initiates increase in mitosis. It utilizes carbohydrate as a, how should I say it, as an energy source for that. The human growth hormone does the same thing, but it utilizes fats for it. There's a couple different changes. Like I said, I don't get a whole lot out of these, but heck, they're here. That's why I don't want to. You want to listen? Go ahead. Well, here it is. Oh, it's signaling. It's spitting something out on the inside. I mean, it could do that. Basically, you're going to see it's a very specific pathway that I will tell you about that you will not hold you to know about. It's called the G protein receptor pathways. Whoa. They're annoying. They're complex. My advanced physiology students, they have to learn about enzymes. We spent 15 minutes talking about the whole shape thing. I'll draw the picture again if you like. Even the membrane of certain cells have enzymes. What those enzymes do, they have a fancy name in the digestive tract. We call them brush border enzymes. That whole sucrose thing is the example. Lactose. Lactose comes along, we digest a dairy product, we break it down, the lactose is exposed. When it gets to your small intestine, enzymes that are embedded in the membrane release the lactase, change it into galactose and glucose, which you have to know, by the way. And that's how they're absorbed into your intestine, how they get into the bloodstream. So we have yet another thing. We have enzymatic activity, we have channels that open and close, and we have signals that can be transduced or changed. And they'll show you this, no doubt. I don't know how they represent it. Not a whole lot. What, they're changing that thing? Didn't do it for me. Aha! These are the first time when we start to see the sugars in the classic example, think blood type. These are called glycoproteins, sugars on proteins. Effectively, these small short chains of different carbohydrates that are genetically different. If you want to think of that with regard to the ABO blood typing system, they're genetically different, and effectively all of your cells have. It isn't just blood type. Your cells have a ton of these markers that protrude. When you are in utero, when you are born, roughly the first 6 months of your life, your body goes through a process called self-non-self. Your white blood cells are circulating through the system, gathering information. They roll. All the cells roll. It's not like I better find out what that is. They just roll over it. They learn to recognize those markers. After about 6 months, the markers are recognized by your immune system. At that point, when they still produce the white blood cells, if all of a sudden you got a cold and a virus came in and it's rolling along and it contacts one of those markers and goes, "What are you doing here?" It latches onto it and starts a reaction we call an immunological reaction. And if it was just like a cold virus, it'll start making antibodies. It'll make enough of those antibodies, it'll surround the virus particles in time before they do any significant damage. The quicker we get a handle on it, the quicker that cold's going to go away. The quicker that stomach bug's going to go away. So they are for identification, recognition of cells to cells. Again, it's not magic, it's structure. They roll over something that they're used to, they just keep right on rolling. They have little places where it rolls and makes contact. If it makes contact with something that will look like this, now all of a sudden it looks like that, and it hits it, it latches onto it. Okay, so again, those short chains of sugars, sugar shell, glycocalyx, identification tags specifically recognized by other cells. And they talk about this, the bad thing about cancer is we make white blood cells to fight cancer. The cancer keeps changing the markers. The white blood cells that were made for what the cancer looked like yesterday aren't effective tomorrow. So it's you will hear, if any of you are going into, and I suspect quite a few in clinical fields where you're treating people, early identification and treatment is the key. If we get on something early, you stand a real good chance at getting somebody better. Maybe not curing them, but treating them in a way that they can survive, improve, whatever way you want. It's been 25 years, and 65% of my patients were elderly diabetics, and that's a minefield. If you don't get on top of those early, they're going to start losing legs like crazy. No fun telling somebody a leg's got to come off. Here's the enzymes, latch onto it, and let something come apart. That's all. And so there's the enzyme. This one's sort of interesting, this attachment. So this is connective tissues like you learned about in the lab. So the cytoskeleton has inside, you're going to learn the cell has fibers inside. It's got filaments inside. These filaments can assemble and disassemble. Some of the filaments are there all the time. We'll learn about what the different names are and what they do and the roles that they play. But there's fibers on the outside. And the way a lot of cells tell other cells what to do is they tug on them. That's what happens in connective tissue. When there's movement, it may be instructing another cell that we're increasing degrees of activity. We're going to need more circulation. We have to acquire more energy. We have to replace additional cells. The messages are sometimes chemical and sometimes they're physical. Okay. And so that pull and tug, and that's what connects them. Their name. You have cells on the outside. You looked at skin, right? Lab, right? Did you do the skin layers? All those strata. So the stratum basal, the next strata is the stratum spinosum. Effectively, what creates that illusion of points on those cells is they're attached to one another. Okay? So they have places where the cells attach to one another, and as they grow away and enlarge, it gives the illusion of seeing this sort of spiked kind of appearance. Living things don't have a lot of sharp points. Trust me. That's something that you see microscopically. We see a lot of things we see microscopically. Most of us think that that's an illusion coming by the fact that it's a dead cell, let's be clear, and it's been stained and preserved. So, I mean, understand, but one of the theories behind it is that the pulling and tugging, it's like when you pull and tug on something, I always have something for a demonstration. I don't suppose you carry this around in your pocket. Well, you don't have a 76-pound dog handy. You pull like that, what happens? It's attached to another cell, you get points. See? So it fixes the location of certain membrane proteins, helps to play a role in movement, all of those things. Everything biologically is attached. Very few cells, other than white cells, red cells, sperm cells, eggs, function independently. Most of them function as a unit tethered to, or at the very least associated with something else. Joining. This is one we're going to look at very, very specifically. Cells are attached to one another. There's 3 different ways they join. The fancy name we give to these, and this is really where I'll tell you where we're getting close to where the first test material ends. The fancy acronym they give them is CAMS, cell adhesion molecules. Depending on who tells you micro, but that's one of the way that bacteria and viruses disrupt things. They disrupt the way the cells heal, attach to each other, and makes it easier for them to get in. Membrane proteins of adjacent cells hook together various kinds of intercellular junctions between cells. Temporary binding site that guides cell migration over other cells' interactions. Cells move as we mature. Cells move during healing, but there's different ways they join. Some permanently, some are stronger than the others, some have different purposes. So again, all the role of proteins. Sugar shell, the glycocalyx. And it's not just necessarily proteins, glycoproteins. You have glycolipids as well. And they all come together, this mostly for recognition. And again, that self to non-self thing that I discussed before. I can't emphasize enough how important that is. Okay. Not so much for us here, but going forward. Because I mean, I always think the hardest individual unit in AP2 is immune system. That's my own. Depends on how in depth they want to get into it. So this is the cancer cells changing rapidly. Immune system can't recognize it, blah, 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 blah. These are the junction points explained further. Not bound to other cells, free, very limited. Red cells, white cells, platelets are cell fragments, sperm cells, even eggs, once they're ovulated, they effectively are functioning on their own. Okay, so, I mean, that would be another good example that's there. Well, although we see that the movement of those is obviously timed, limited because of monthly cycles. Okay. 3 types of junctions. Tight junctions. If you hear the word tight, it means watertight. Desmosomes, the strongest. Structural integrity. Cells that have to hold together by design and not be separated. Gap junctions are basically, and another name for gap junctions, I'm sure they have it. I may even be spelling it right. I think it's connexons, or maybe one X or 2. Basically, a gap junction has proteins arranged in such a way that it can communicate by sending either charged particles or chemicals for cells that are in close proximity. This is it's the way your heart works. An individual heart muscle is strongly connected by desmosomes to the next heart muscle, actually 2, so they branch. And then the chemical signals at that same area, if I just contracted, it's your turn. It's kind of like that, it's kind of like dominoes. One domino hits the next, hits the next, hits the next. You see all those clever way we do those things. Effectively, that's what it is. It's telling the next cell right away to do this. So your heart, in a matter of less than a quarter of a second, completely contracts. Good? It's a good thing. So you'll see them, tight junctions. Adjacent cells, think lining cells, fuse to form an impermeable junction that encircles the whole cell. Fluids and most molecules for moving. The more tight junctions you have, the less likely. The lining in your stomach, because so much acid, have a lot of tight junctions. So the acid can't get there. So when you're eating the wrong stuff, you're downing a bunch of ibuprofen, you're drinking ridiculous amounts, you're studying all night, you're drinking ridiculous amounts of caffeine beverages. They damage that lining. And you're saying, oh, it's killing me, I got indigestion. Okay, that's part of what's happening. You're allowing some of that acid to go deeper, and people do it long-term to a thing called an ulcer. Okay, and normally and a lot of that comes from a lot of different factors: stress, non-steroidal anti-inflammatories, caffeine, alcohol. For people who drink, all that's part of it. So effectively, some of them are designed to allow a certain amount of fluid or a certain amount of molecule. Even other areas of the digestive tract, some of the cells are not quite tethered as closely together. So we can absorb particles either through the cell or even between the cells, depending on what they are. So there's variations that are there. So you're going to see a lot of that. I'm just giving an example where it would be useful. So this is what it likes. It's almost like if you had a belt that you could tether the cell and then the next cell. The analogy I use, it's like, I know it's a little different because we do everything electronically. But maybe in the old days when we would have a report, you could have, let's say you had 10 typewritten pages. Maybe you submitted a hard copy. And you put a staple. If you put a couple of staples in, you could get something through there very easily. If you put a series of staples all the way along, you couldn't get, nothing would necessarily squeeze through those papers. Or if you ended up putting like a binder on it or laminated it, certainly nothing would get through. The idea, the more of these that you have surrounding, not only do they hold the cells together, they limit these spaces. They make them smaller, and effectively that makes them more watertight. There's no better example of this than in the brain, because the blood vessels, the capillaries in the brain, are impermeable to water. It's called the blood-brain barrier. We get to that in this class. So you can see here they are, interlocking junctional proteins. The strong ones are desmosomes, rivets. They have fancy name, cadhedrons, interlock like teeth of a zipper. I'll buy that. They're anchored. It's almost like you have I am the least mechanically oriented person. It's kind of like having a washer and a nut and a screw. For you mechanically, it's okay. My middle son built a race car. All that, he didn't get any of that. He's watching me do it, and none at all. Oh, Dad, I'm putting in a new catalytic converter, right? We're lifting out the engine. Good for you. Go for it. Okay. I am not mechanically oriented. Okay. My daughter, oh, we're just changing the water pump, Dad. It'll be easy. So you'll see these. So these little plaques, they call them button-like areas, all of this. And look what they utilize. Go back to skin. Keratin filaments. Connect the plaques, anchoring extra strength. They allow a certain amount of give, like your heart contracting, but it doesn't tear. So only somebody you could imagine somebody tearing a heart muscle. It's almost impossible unless their blood pressure was just so out of control. And what out of control high blood pressure does, it makes the heart so thick, okay, it enlarges, and then it doesn't pump anywhere near efficiently. And if you think a bigger muscular heart is better, it's not. There's a law of diminishing returns. So, voila. This is really what the structure is. These proteins that link, these plaques, more of these keratin filaments, extraordinarily strong. And so in certain kinds of cells, we have a lot of these desmosomes that hold them together. And lastly, 1X, in the connexons, tunnels. You see the arrangement. It's almost like the proteins have a little opening that's there. So ions, simple sugars can be signaling molecules, electrical signals, that's classically how the heart does it with charged particles, particularly cardiac and smooth muscles. So there's what they look like. So here you can see two membranes. There's very little space between the cells, but it's enough rather than one membrane pulling and tugging. Here you're sending a chemical or an electrical signal that's much more rapid. It's there. That's it. Substances constantly move, some easily. That's the whole idea of selective permeability, which brings us to the really, and that here, that is the end of the first test material. Once we start this thing called movement across membranes, passive and active transport, which we're going to start and try to get through some of it today, that's all next test. So you're good to go on that. I am sure between now and when next we meet, I will have recorded this. I'm sure I'll end up doing it over the weekend, most likely. So I'll get that all set up and we'll be in good shape. Stuff is constantly moving in and out of cells, continuously. Sodium and potassium are moving this very minute through almost all of your cells, constantly. They are setting the membrane so it remains in its appropriate degree, it's an appropriate electrical state. Sort of the end point of all this called resting membrane potential. Okay, the plasma membrane is by definition selectively permeable. It's a living membrane. Some can come in, some can get out. By and large, we try to limit active transport because that is an inefficient way to utilize energy. When we do have to do it, as I alluded to before, we try to be able to move more than one particle at once. Try to get maximum effect for spending our energy dollars, so to speak. Most of the things we do are passive transport. Indeed, what we will do sometimes we'll spend the energy to amplify passive transport. That's the way something called the proton motive force works in our body by way of something called the Krebs cycle. Thankfully, I don't have to teach it. So this is classically presented. We'll start with the first one. There will be a matching. The matching will have things, all these terms: simple diffusion, facilitated diffusion, osmosis, active transport. Okay, got the idea? And some of the other things like endocytosis and exocytosis we will get to, maybe not today. So you already have the key. So it's all we have to do is discern the question. Press the next one. Simple diffusion. Okay. You will see is all about small fat soluble particles. Classic example is oxygen and carbon dioxide in your lung, or even at the tissue level, cells. Facilitated diffusion, you're going to see the best example is what insulin does, indirectly opening the passageway for glucose. And these are by passive means we don't have to expend energy, and water, by the way, moves all the time. That's called osmosis. That's the simple diffusion. So all types are natural movements from areas, and make no mistake, it derives the force, concentration drives the bus. That's the single most important factor of my molecules. Effectively, you have an epithelial lining, simple squamous, in your blood vessels, your capillaries, and the lung. You have a simple squamous lining here in the lung itself. Little dots are for nuclei if you want. They have a common membrane, not this thing. If I were to draw it correctly, and maybe it would be a better way if I drew it correctly, there's like a layer of material, and then the cells are like that. They actually share a basement membrane. The cells are all interlocked. There's really not a lot of space for moisture to get through. Good thing in the lung. And so basically what happens is this. In the capillary, the blood's going to be oxygenated. You have a lot of carbon dioxide. You you have a little bit of oxygen. Here in the lung, you just inhale, you have a bunch of oxygen. You have a little bit of carbon dioxide. Greater to lesser. And the beauty of simple diffusion is just because oxygen, wait a minute, I'm moving, I'm oxygen. Carbon dioxide, you wait. It doesn't work that way. They can both move simultaneously, instantaneously. So at the same time, oxygen is flooding and reoxygenating those, the carbon dioxide is going to be expelled. That's classic simple diffusion. Best example, pulmonary respiration. Absolutely. Concentration gradient is the key. Concentration gradient can be involved with solutions, how many sodiums compared to how much water is there. Concentration, in this case, is about gases. So there's a lot of things that make concentration. So its number of particles could be absolute or in solution. And all of this, what really creates it is this idea, they talk about collisions. Again, when you have a high concentration, molecules are always moving. They slam into each other. They move away. By doing so, they get pushed farther away. It's like if we had, like I frequently have in the other rooms, 35 to 40 students, everybody comes in and the seats eventually all get taken. You're not going to all, I'm going to pull 6 chairs over and be over here. Not going to happen. We don't even have enough chairs. Movie theater, same, pick one. Someplace we don't have assigned seating. So higher collisions with temperature, it makes it happen fast. Temperature is to your advantage up to a certain point. So when it's hot outside, maybe you're breathing a little bit more rapidly because you're accelerating those collisions, but you're probably requiring more oxygen. So you'll see a zillion of these things, here's a beaker, put a blob of dye pellet, and before you know it, depending on how it's constructed, it'll start to diffuse, and within X amount of times, you can tell that's what diffusion, and it's even. Or distribution. That's classic simple diffusion. Particularly so, the model of the lung is the best influence. Concentration, small particles, oxygen and carbon dioxide are tiny. Temperature. And it doesn't stop. I understand that whenever we get the idea of what equilibrium is, effectively an equilibrium is established when you have as many particles moving in and moving out. If you marinated a piece of chicken, put it in a zip top bag with some kind of nice marinade in it, effectively, it's not like all the flavor moved into the chicken and all the yuck came out of the chicken. Once an equilibrium is established, you have salt moving in and salt moving out, sugars moving in, maybe balsamic vinegar moving in and moving out. Well, an equilibrium doesn't imply the stoppage of movement. It's just everything is balanced out and you'll have as many particles coming in as going out. That's all it means. Living systems don't go to a standstill. They're not static, they're dynamic. Things are always moving. So temperature will increase it. By the same token, typically when I marinate something, I stick it in the fridge. Not so much that I wanted to slow down the process. I don't want to leave the chicken or the meat out. Okay? It's a me thing. A wonderful Asian marinade for chicken if you're interested. It's not mine, it's Emerald's. Celebrity chef. So equilibrium is reached only when there's no net movement. Things of stuff moving in and moving out, they're basically staying the same, what we would count them. Natural drive down the concentration gradient, nonpolar, hydrophobic lipid core of plasma membranes, fats. Stop diffusion and create concentration gradients by acting as a barrier. So that's where we get the differential permeability, depending on what's coming in. The ones that are easy, lipid soluble, nonpolar, and that's oxygen, carbon dioxide, symmetrical, and small, simple diffusion. Best example, lung. Facilitated. I just spoke about it before with the insulin, with that model of the signaling molecule. Large molecules, or ones particularly that are charged, polar, that means they're non-lipid soluble. They can't get through without assistance. That assistance is facilitated, even if there's a whole bunch of glucose, even if there's a whole bunch of sodium, unless that doorway is open, they can't get through. So if the doorway by intent is closed, anything that opens it, however it opens it by a signal, okay, however that signal gets there, will basically open that passageway for X amount of time, and in it comes. You don't have to expend any energy. They're hovering out there. I'm waiting. Somebody wants to get in. There's no assigned seating. They want to get in. They're waiting for the doors to open for the show, for the concert, whatever. It seems like such a long time ago. They did that once in 1980 in Cincinnati, and 9 people got killed at a concert. The Who, a very famous classic rock group, was playing there in 1980, and they sold out every ticket, and they said, oh, it's going to be open seating, not realizing that when the doors open, people are going to get trampled. And you had the auditorium, 15, 20,000 people, 9 people died. I'm trying to remember the date that happened. Just to give you an idea. So it can be somewhat uncontrolled and very rapid. That's facilitated diffusion. None of these include water, because water is something in and of itself. Water is its own solvent. And we talk about what I've talked about with diffusion, whether it's gases, because gases dissolve in water, whether it's particles, because particles dissolve in water. Now we get to this important thing, the relationship. And this is always the one that frustrates students. I mean, the terms that I will present to you on the exam are this: solute, stuff dissolved in water, and solvent. Read that as water. And stuff, again, it's all about the number of particles that are there. Okay, so when we're moving solute in a passive way, we have diffusion and facilitated diffusion. When we're moving a solvent, that's osmosis, movement of water, just like anything else, from an area of higher concentration to lower concentration. To wit, if I had 2 vessels and a magic membrane between them, and I have equal amounts of water here. So if I had sodium, 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 potassium, 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 chloride, chloride, whatever. If I had, that's 3, 6, that's 8 particles, and I had a sodium and a potassium here, even though I have 8 particles to 1 unit and 2 particles to 1 unit, okay? You going with that? Okay. This is more concentrated in terms of particle. This has proportionally more water. All you do is flip the fraction. This would be 1/2, that would be 1/8. I don't know where you come from. 1/2 of something is better than having 1/8 of something. Thinking pizza. It's 3 more slices where I come from. What do I have for dinner? Okay. So what happens is, to balance that out, a living membrane that has pores for water, effectively, it'll cause the water to move to balance it out. So effectively what would happen, the water will move in this direction. Assuming these guys can't move, all of a sudden the water level is going to go up. You can do this experiment. We used to do this experiment all the time in the lab. It forces water into it. And a lot of living things is used all the time. I told the other class about cooking. You use this all the time. If you make French fries, you go to McDonald's, and if you work at a fast food place where they make French fries, what happens is they take the potatoes, ones that make fresh fries. It's a double fry process. You basically take the potatoes, you put them through things like that, it causes the strip that we call French fries to form. But maybe they probably have a way of removing basically, the exterior of the shell of the potato. Then at that point, what do they do with them? Just like we do at home, we put them in water, make your mashed potatoes, boom, right in water. They don't change color. What that is doing is the water is being brought into the potato. Why it helps with French fries is they don't get limp. If you leave them in water, even for a brief period of time, they're quite firm. If you not put them in water or not in a sufficient amount of water, they're kind of limp. Nobody likes to limp French fry. So it creates the rigidity, and then you double fry them. You fry them at like 310 Fahrenheit for X amount of time. That blanches and cooks them through, and then like 350 to 375, that browns. Afterwards, season. There you go. It's food science. Food science works. It's part of that idea of where osmosis can be used to be your friend. We do it all the time. Biologically, this happens constantly. Water is always moving. And that's why and because it is so important, we have to be careful not to make our cells, if we have too much water going in, the cells will explode. If we have too much water going out, they will shrink and shrivel. Neither of those are good. So, plasma membrane, this is homeostatically speaking. If the plasma membrane is severely damaged, this is what happens in burns. You did a burn, did you talk about burns when you're doing skin? Biggest two problems in burns. Infection, which is afterwards. Burn tissue is like a comfort food for bacteria. And loss of fluid and electrolytes. Biggest single worry that you have. Burn patient comes, did I tell you this? When burn patients came in, when we were in the ER, it was a terrible fire that occurred, and it was a disaster on Christmas night working in the ER. It's 48 years ago. They came in, I didn't even know how to start an IV. Boy, I learned that night, because I was one of the few people who were working. Every time one of these patients came in, it was just burnt and awful, and we lost 2 in ER and 2 in ICU. You start a wide bore, the attending said to me, and he was a part-timer, he was moonlighting there. A kid who was a urology resident said, all right, every time somebody comes in, you get a wide bore IV, you put 2 of them in, and we run fluid wide open, because they're going to lose fluid. I learned real quick how to start IVs. We didn't have those neat little pulse ox things. We had to do blood gas. I learned real quick how to do that. We had a full-blown disaster drill. An amazing learning experience. And it's not just me. Every doctor, every nurse has war stories about nights where, oh my God, everything went wrong. 515. It goes super fast. When you're working in critical care, it's for young people. I mean, you don't see, it's just not, it's not for the older. So and this would happen, you lose all this stuff. And so you have to already start replacing it. So that's why it's so significant. So when we talk about simple diffusion, phospholipid, oxygen, carbon dioxide, steroids, which are relatively small fats, fatty acids, small fats, even tiny amounts of water kind of play that route. But it's really not a good way to look at it. Again, I don't think you get a whole lot of that. Concentration gradient, moving the stuff, who cares? They're just showing you simple diffusion of the lipid-soluble stuff. This facilitated glucose, amino acids, charged particles sometimes. You're going to have ones that work through a carrier or ones that go through a channel. Substance that move through a channel, the implication is it's always open. Carriers indicate that it requires a shape change to bring particles in. So carrier mediated is facilitated. Sometimes they do open channels, but typically the implication of channel that it doesn't involve a shape change. You're going to see a lot, you're going to get sick and tired of me talking about leakage channels, voltage gated channels, ligand gated channels. You're going to get sick and tired of hearing me about that, because that's when we talk about muscles and nerves. Membrane protein, very specific. If it's a chloride channel, sodium can't fit there. You're going to see sodium and potassium can share some channels, but a lot of it has to do about size and shape. One of the things that does happen if those channels are occupied, we call them saturated, and that's one of the factors that limits it. That's there. Here they're just showing you shape change. Here's a sugar on the outside. You can see that hexagonal thing. Here's the carrier. You don't have to have a signal necessarily with this. Okay. It's still in this case, The signal isn't facilitating the diffusion. The presence and the ability of the carrier to change shape is doing it. It can accommodate it, change shape, and spit it out. Just the very fact that that agent is coming close to it may be enough to bring it in. Again, that's that thing I wrote before, induced fit plays a role in that. So transport ions, water, here's the aquaporins. Again, leakage channels are always open. Ones that change shape typically implies we call them gated channels. And what causes the gate, what's the key to open the gate, whether it's a chemical, whether it's electrical current, whatever. This is a definition you're going to get to. Like I said, you're going to be sick of them. So, showing you some channels. Great. Osmosis. Solvent movement. Again, water diffuses through a bilayer. Even though water is polar, it's so small it can sneak past. And that's the fancy name of specifically water. We call them aquaporins. You'll see that again if you're taking micro. And water is not the only solvent for our purposes. It is the solvent. So they're just going to, they'll show you the animation is probably halfway decent. This is the whole idea of talking about, I gave you that vivid example, burn patients. We basically were using a solution called lactated reuse. That's pretty much SOP, standard operating procedure at that time for burn patients. Burn patients were. This is the whole idea. All of those fluids, you intracellular, extracellular, they all have what's called a specific osmolarity. There's another definition. Effectively, what it is the total number of particles over a set volume. Particles are different. Okay, salt, when it goes into water, sodium and chloride, 2 particles. Calcium chloride, CaCl2, 3 particles. Just for example. Glucose, bigger than both of them, 1 particle. So it's not about the size, it's about the number of particles. The number of, because they exert a certain degree of force. The number of particles per unit volume is what we call osmolarity. But if you do it to weight, it's called osmolality. You don't have to know that. So it's what's dissolved in it and how much water they're displacing. When you have more stuff dissolved, that's water. That's what I showed you before. And water, just like anything else, higher concentration to lower concentration. So we're very careful. When that patient came in from the burns, and that's an absolutely real story from Christmas night, the hospital is no longer there anymore. My wife at the time happened to be the assistant head nurse. On that shift, she was the head nurse in the room. It's Christmas night, being Jewish, we were more than happy. So our friends and colleagues there could celebrate with their family. Doctor came in and said, I had the same last name I did over. God was attending. Nevertheless, the reason we started, the 3 things that at that time that we started, you would not put in pure water because it would force too much water into their cells and they would explode. You certainly wouldn't put in salt water like seawater. It would suck the fluid out. That's what you're going to see very shortly. They're going to show you kind of what it does to the cells. So there's certain things, something called normal saline. What makes it normal, it's not that you're using regular table salt or anything like that. It has to do with this. Okay? It has the same osmolarity as the fluid inside your cell or outside your cell. And effectively, it's a very small amount, 0.9 grams of sodium chloride, good old regular table salt, to 100 milliliters of water. That's a 0.9% NaCl or saline solution, you write it like that, and that is called normal saline. That's what makes it normal. Number of particles, molecular weight, all play a role. We don't have to do the mathematics. Okay. The other that was used at that time was called D5W. Dextrose, which is like the active form of glucose, 5 grams in 100 milliliters of water, by the acronym D5W. What we infused was lactated Ringer's solution. Think of that as a combination of salts and sugars and other chemicals that are very similar to the tissue fluid that was lost. Lactated Ringer's is used a lot, or was, in trauma. I used to use the terms like biological deodorant. So, and they're showing you how the equilibrium, and the animation, they just do that. Here, the magic membrane here, okay, you have more particles here, less particles there, same amount of water on either side, but the particles can move, so they'll balance out. That's equilibrium. And every so often, want to move this way and want to move that way, and the water molecules want to move that way, want to move that way, because unless it's an absolute zero, things are always moving. Got that? We're getting there. God bless her. My wife's out with another man. It's okay. It's our problem. His wife died about 4 years ago. He's both of our best friends. After like a 10-year battle with breast cancer. God bless. Oh, God. Wonderful people. They're going to spread ashes. Not for his wife, but for somebody else who died, I think. So, moving along. So, it's always moving. That's code for fend for yourself for dinner and walk the dog. So, again, if it's water, look at this. So what happens, here's the membrane, but it's only for water. Let's say you flip the switch and the membrane open. It's just what I tried to demonstrate before. We'll compensate for the differences by moving the water to compensate. That's all that means. More particles over here, less here. So we'll move some water from side A to side B and compensate. The movement of water is called hydrostatic pressure, force of water. Outward pressure exerted on the cell membrane, okay? There's a force. The fluid in there has a force. Osmotic pressure, proteins hold on. Remember I told you about proteins, colloids, they hold on to water. So there's a tug of war going on. The water inside the cell wants to push out. The proteins hold it in. Again, it's dynamic. At certain times, you'll see in the bloodstream, how does stuff get into our cells and get out of our cells? How does stuff get into our kidneys and become urine? How do we reclaim stuff? It's all about these forces. It's the relationship between and why your blood pressure is so important, because it influences how well your kidneys function. It influences how well or how efficiently we get nutrients and waste products and move them around. We take that for granted because it's silent. So when hydrostatic pressure equals osmotic pressure, things don't move. Plant cells don't care. They have a cell wall. Okay. It's pretty hard to overwater a plant, but you can overwater us. It was an absolute true. X number of years ago, when that Wii system came out, a disc jockey on radio thought it'd be cute out in California because of the term WII, and he said, if we'd have a contest of who could drink the most water, and without having to go to the bathroom, and the winner of that would get a Wii system for their kid. The lady won, she died. She overhydrated. You could believe it. Absolutely true. One of those stupid, radio things that happened. I don't know if they still happen today. So the plant cell, if a plant's droopy, what do? You water it. Plants want to be watered. Go ahead, water me. Make my day. You're going to water me? I didn't get you anything. Animal cells, not so fast. So here's what happens. If it's if it's normal saline. If these called isotonic, same tonicity as the molarity, same osmolarity. Hypertonic, salt water, 3 to 5% salt. It's like seawater. It's going to pull water out. It causes the cells to shrivel. It's called crenation. Hypotonic pushes it in. Okay? So the cell has a danger of bursting, like I did in that example, or lysing. So we call it plasmolysis. Plasma membrane splitting, lysis. Don't do the calculations. I've done this example in the lab. It happens so fast in blood cells. Isotonic blood cell looks the same. This is crenation. It gets little bumps. Actually, the red blood cells, which look like little circles, become like almost have little sharp points. Irregular. You can see in sharp points, like living systems avoid those. The cells burst so fast, and I'm probably the fastest guy here, focusing a microscope. I've been doing it for 60, 70 years. Okay? I can't they've already burst by the time I get it focused. And so that's basically what happens with that. And that's the end of today. We start next week. I know it was a fair amount of material. I'll get that stuff to you. Appreciate the time that you shared together. I know it's going to be, you're allowed to ask a question every so often. I know it's a novel concept. I figure I can jokingly goad you into this.